Good morning, guys. Today we are going to be talking about the skeletal system and how our bones work together to help us have a structure and a framework for our body. So our goal today is to write some notes in our journal about the skeletal system. So our question for our bell ringer, which you guys maybe don't get to see, but I don't know if you guys are wearing your Disney, but I got my DuckTales shirt on today. Anyway, okay, back to the lesson. So there's cartilage, like this flexible stuff that makes up our ears, makes up the tip of our nose. It's kind of a tough structure, but it's a little flexible still. That is what attaches our rib cage to our breastplate right here, the bone, your chest bone. Why do you think it's important that we have cartilage there with respect to breathing? The reason we have cartilage there with respect to breathing is because if our ribs were solid bone, we wouldn't be able to breathe in as much air. Take a deep breath. What does your chest do? It expands, right? And so the cartilage allows your ribs to be a little bit more flexible when you breathe deeply. All right, so we're going to be writing this in our notes. I have attached to this assignment the fill in the blank notes. If you don't have a way to print those, I'm sorry, but you're going to have to write all of it in your journal, okay? Bone is where we're going to start because bone is what makes up the skeletal system. Bone is a type of connective tissue, and connective tissue is just one of the types of tissues that makes up the human body. We've got muscular tissue, we've got connective tissue, we've got epithelial tissue, which is like our skin. And so connective tissue is usually very strong because it's connecting things together. So it makes up the endoskeleton, or the skeleton inside vertebrate organisms. Like us, we have a vertebrae, a backbone, and so we are vertebrate animals, organisms. There are 4 different types of cells. There are osteoclasts, which destroy bone. And you're thinking to yourself, why would you want to destroy bone? Well, sometimes our body needs the minerals that are stored in our bones. And so our body uses osteoclasts to break down those bones so that we can absorb the calcium or whatever we need from our bones. This happens a lot, especially to women as they get older. If you've heard of osteoporosis, this is when our body pulls too many minerals out of our bones, and it can leave our bones weaker. Osteoblasts build, and I remember it because B is for building, right? So osteoblasts build bones. They are the little construction workers. These are really active in babies as they grow into toddlers because babies are born with a lot of bones that are separated, and bone gets built together as they grow. Because remember, cartilage, flexible, bone, not as flexible. Osteocytes is a general term for cells of the bone, and these help hold our bones together. They give our bone structure. And then the lining cells, these help to protect. These are usually around the outer edges of the bones. Okay. All right, the job of the skeletal system. It has 5 main jobs. And you're thinking, what? Really? Yes, your bone structure is super important for lots of reasons. Obviously, we know that it gives shape and support to our body, right? Otherwise, when we moved, we would just be like a blob, right? Because all of the things that we move with our muscular system are bones, right? We move the bones with our muscular system. So the shape, the support of our bodies is formed by our bones. It also protects our internal organs. What protects our brain? Our cranium, our skull, a hard outer shell to protect that control center for our body. What protects our rib cage and our heart? What protects our lungs and our heart? Our rib cage. It protects it from injury, right? It kind of gives it this cage to protect it from injury. It allows us to move, right? We just talked about how muscles move bones. If we didn't have muscles and bones working together, we would not have movement. In fact, I talked about this when we did our first intro video about body systems, but blood cells are manufactured in bone marrow. They're made, right? So red and white blood cells are made in the marrow of long bones, and we're going to talk a little bit more about that in just a minute. And the last thing that it does is it stores calcium and phosphorus for us. And that's one of those minerals. Calcium is one of the minerals that I was talking about that our body sometimes has to break out of storage and use, right? As we need it. All right, the structure of the bone. So this word part that we've seen before, peri, like perimeter and pericardium, right? Periosteum is around the outside edge. And so it's around the perimeter. So this is the membrane that covers the outside of the bone. Okay. It covers, it protects. This is where blood vessels are. You can see down here in the diagram, number 1, that we've put in some blood vessels and some nerves because we do have feeling in our bones. If you've ever broken a bone, you can speak to that and know that it definitely has some feeling, right? These blood vessels and nerves are very important for getting blood cells from the bones, remember, because they're made inside the bone marrow, to the rest of our body. Okay. Compact bone is a really hard bone. It's what it sounds like. It's very compact. It's very squished together. It provides structure to the bones. And usually we see that hard bone around this is called the shaft in the middle, right? We see it around the shaft. It kind of protects that outer layer. You can see here, even it goes around this outer edge where it's really pushed together and compact. Cancellous bone, otherwise known as spongy bone, it looks like a sponge. It contains blood vessels and marrow, and it's got more spaces in it. And this helps us to still have some flexibility in our bone structure. And it's why every time you bump into something, you might get a bruise, but it doesn't break every time we hit something because that spongy bone can absorb some of that shock like a sponge. The marrow is that soft center, and I talked a little bit about this when I first introed all the body systems, but if you go to H-E-B or grocery store and you look on the soup aisle where there's chicken stock and other things, in the last few years, bone broth has become really popular, and maybe you make bone broth at your house. But that's when you take animal bones and you boil them and you cook them. And what happens is the fat that's stored inside the marrow is released when you cook them. And so when you go to the grocery store and you see it, it's all of these jars. And on the top layer of the jar, if it's a clear jar, you can see that there's a thick layer of fat. And that's because there is a lot of fat that's actually stored inside your bones. It gives it that jelly-like consistency. The yellow marrow is the fat cells, right? That's where that fat is being stored. Now, there's also another very important job that's happening in your bone marrow, and that is where red and white blood cells and platelets are manufactured and made. And you need a constant supply of those blood cells because red blood cells are going to help protect or help you carry oxygen where it needs to go, glucose where it needs to go, carbon dioxide where it needs to go, right? It's the transportation system. And white blood cells work through your immune system and help protect your body from infection. Platelets are very important because they help stop bleeding when you have injury. So if you didn't have platelets, and there are disorders where people have much fewer platelets than they should. If you've ever heard of the disease called hemophilia, this is a disease of the blood platelets. There's not enough clotting factor in the blood to stop bleeding when someone gets an injury. And it's not just a bleeding injury. It can be bruises, right? So if you know someone with hemophilia, they may have to act a little bit differently sometimes. They can't, run and jump on a playground or ride a bike as easily because they have to worry about if they fall and get a bruise. Because remember, a bruise is still bleeding inside your body. It's all those tiny capillaries that kind of get ruptured when we get an injury. And if you don't have enough platelets to stop that bleeding inside your body, you can get a large amount of blood released into your body in places where it doesn't go. Because remember, we're not just full of blood. Our blood is contained in blood vessels, and those blood vessels are where the blood needs to stay. Okay? So all of that's happening in your bones all the time. Here's a kind of a different picture, right, of that porous bone, that spongy bone, that shows how it can be a little bit more flexible, right? And this is that compact bone, that hard bone. You see how it has way fewer spaces. Lots of space here, not very much space here. All right. When you are a baby, like this cute little guy, your skeleton starts out as cartilage, which gets gradually broken down by those osteoclasts and replaced with bone made by osteoblasts, which is why babies have more bones than adults. Babies are born with around 300 bones, and when you're a fully grown adult, you should have 206 bones. Now let's talk about where bones meet other bones. These are called joints. This is any place where two or more bones are going to come together. Cartilage and ligaments help protect joints from injury, because if bone touches bone, remember I told you there's nerves in that outer layer, that periosteum, and so it can cause a lot of pain and discomfort. And so we don't want bone to hit bone. We need cushiony layers to protect us. And so cartilage is a rubbery tissue that cushions bones at the joints. And we have a nice shiny layer of cartilage around most of our joints, most of our large joints. Ligaments help connect bone to bone. And in your hands, you've got a lot of ligaments. If you've ever heard of your ACL or your MCL, maybe in sports, maybe an athlete that you like had an injury to one of these ligaments in their knee. These attach the femur, the top bone of your leg, to your tibia and fibula, the bottom bone of your leg. They control kind of your knee, and those ligaments are really important to athletes because if they injure them, it affects their ability to play. And so you've got ligaments all over your body connecting different bones together. And so those cartilage is going to cushion, and ligaments are going to be like strong, tough connectors, right? Like kind of like rubber bands holding everything together. You have several different types of joints, and we're going to kind of look at some examples and why there's different ones. The first one is a fixed joint, and this is like the joints in your skull. So I actually have my Fred Jr. over here, and if I pull him up, you can see all these little ridges in his face and on his skull. You can see here, we call these sutures, and these are where bones grow together, and these are fixed joints. These allow for very little movement, right? Your cranium, your skull doesn't really move a lot, and most of these that we see are found in the joints of the skull, right, of your cranium. And because the skull is made up of lots of different bones, I don't know if you guys can see it as well, but all of these sutures, all of those lines, they're making up those fixed joints. So if I ask you for an example of a fixed joint, joints in the skull, right? Pivot joints happen when a bone rotates around another bone. And so when we look at Fred, let me go grab him. All right. So now I hope you can see a little bit better. So if you look here, our elbow and our wrist, these two bones right here, actually make up a set of pivot joints. So our elbow is a hinge joint. It only moves in one direction. If you can see right here, you can see that these two bones are really the only two that connect. But this bone right here, watch when I turn the wrist, right? It pivots and turns around there. So our wrist is a really good example of a pivot joint. You can also turn your head, right? That's a pivot joint. At the top of our spine, we can move our bones so that they pivot, so that we can look in different directions, right? Okay, move myself back over here. All right, so fixed joints don't allow movement. Pivot joints allow rotation. Okay, those are our two so far. Ball and socket joints. Fred also has a very nice ball and socket joint right here. Can you guys see why we call it a ball and socket, right? Because it is a ball, right? This bone makes a nice ball at the end, and it fits right into this hole, this socket. And so your shoulder and your hip are the two ball and socket joints that you have in your body, and they help us to have range of motion, right? That's how we can move our arms forward and up and down and all around. And they allow you a lot of flexibility. And some people have really hyper flexible joints. And so ballerinas, contortionists can sometimes really extend their joints and make some really interesting moves with their body. Hinge joint is going to be a joint that only moves in one direction. And so a hinge joint is going to be your elbow and your knee. And a lot of times when I tell students that your knee and your elbow only move in one direction, you're like, oh no, I can move it in other places. Try moving your knee a different direction without moving your hip. Your hip is what's allowing flexibility, because remember, it's got that ball and socket joint, which allows a big, wide range of motion, a wide variety of places it can move. Hinge joints are just like door hinges. They move in one direction or the other, right? They move like a hinge. The sliding joint is the last joint we're going to talk about, and these are most common in our wrist and ankle because you have a lot of bones that make up your hands and your feet. And you can see here that Fred has a lot of these joints. And so these joints make up all the wrist and the palm. And so in order for them to move, they slide past each other to give flexibility in there. Now, are these going to be super flexible? Right? Because they're small bones, lots of ligaments. Remember, those ligaments are like the rubber bands that hold it together. And so these sliding joints are going to just allow small movements, very small movements. All right. You are also going to label a skeleton today. So I've also included this in your notes. If you do not have the ability to print, then I will include a Google slide where you can drag and drop those. It won't be for a grade, but you will be doing a project tomorrow and Wednesday and Thursday. Sorry, tomorrow is Wednesday, Thursday, and Friday, 3 days, where you're going to need to know those parts. Okay, so if you'll label your skeleton, the left side like this. Your ocular orbit is your eye, right? Your maxilla is your upper jaw. Your mandible is your lower jaw. Your mandible is movable, right? Your scapula is your shoulder blade right back here, right? Your sternum is your breastplate right here in your chest bone. Your xiphoid process is the very tip of this bone, your breastplate, your sternum. The thoracic vertebrae are the vertebrae that make up the thoracic cavity, and the thoracic cavity is the cavity where the ribs are enclosing your lungs and your heart. And so that right here is going to be the arrow pointing to your thoracic cavity. Sorry, your thoracic vertebrae, your backbone. Remember, vertebrae are backbones, part of your spine. The lumbar vertebrae are down here. These are the 5 vertebrae in our lower back. Your ilium is here. It's your hip bone. If you're skinny enough to where your hip bone sticks out, or you can maybe lay down on the floor so that it pokes up, that is your ilium, your hip bone. Your ischium is down here. It's your butt bone. Maybe if you can feel your hip bone, you probably can feel your butt bone too. And that's what gives that little knob when you sit in somebody's lap and they're like, oh, you're hurting me. Your femur is this very large bone, your thigh bone. Your patella is your kneecap. Your tarsals are down here. These are all of our ankle bones. Those are those really tiny ones that I was showing you guys in Fred's hand. Let's see if I can get him to bend his knee up here. So here are your tarsals in your feet. Oop, wrong way. You can see them all there. Your metatarsals are the sole of your foot, so that's a little bit farther forward, right? And then your phalanges are all the way here on your toes. Your calcaneus is your heel bone, and so it's going to be this one right here that's kind of in the middle. All right, so that's the left side of your skeleton. Now, you're going to have to do some things in your project. You're going to need to know where blood vessels are manufactured and created, and those are going to be mostly in our long bones, like our femurs and your humerus, which is this arm bone up here. All right, so let's label this side. Let's see. Move me over here. Nope, I won't be able to read. There we go. Okay. The cranium is the skull, right? So it is what we talked about earlier. It is this whole set of bones that make up the skull. Your frontal bone is your forehead. This is the large bone that is on the very front of the skull. That's your frontal bone. Your nasal bone is your nose bone, and it's a lot shorter than you think it is because a lot of our nose is made up of cartilage. Your cervical vertebrae are the vertebrae in your neck, so that's going to be this one right here. Your clavicle is your collarbone. You you might can feel your collarbone, and you can see it on the diagram here. Your ribs, you have true ribs, you have false ribs, and you have floating ribs. So true ribs are ribs that fully connect to your sternum with cartilage. False ribs are ribs that connect to other bones cartilage, like right here, right? And then floating ribs are these very lower ribs that sometimes don't even connect with cartilage. They're floating, right? So our rib cage is going to be this one right here. Your humerus is your upper arm. Remember, that's one of the ones I was talking about where your blood vessels are, not blood vessels, blood cells are made. Those are mostly in your long bones, and your humerus is one of your long bones in your body. All right, so your radius, if you look over here at the diagram, is the bone that moves around the ulna, because the radius is around, right? And so if we look at Fred, our radius is this bone here. It's the one that turns. And so if you look at your diagram here, it's going to be this top one right here. It's this bone. Your ulna is going to be the one that's closest to your pinky finger over here on this side. And the ulna is the one that makes up the hinge joint with the humerus at the top, right? So it's on this side. You can see on Fred, and on the diagram, it's on the opposite side. Okay. Carpals are your wrist bones right here. Your metacarpals are the palm of your hand, just like your feet, right? We've got carpals, which are the wrist bones, and then they get a little bigger in your palm. And then we call them phalanges, your fingers, right? So that's going to be down here. Your sacrum is your tailbone. So if you can see it on Fred, it's right here, right? This is your sacrum. It's this kind of triangle-shaped bone, and it's right here at the base. And just below it is your coccyx, which is your tailbone, right here, the very tip. The fibula is the outer calf, so that's going to be this first one right here. It's the thinner of the two bones. And your tibia is your shin bone. It's the thicker one, okay? And if you were watching the Cowboys game a couple weeks ago, there was an injury, right, to Dak's tibia and fibula. So those are the bones that you're going to need for your project. I'm going to include a diagram for you to print if you have that ability. If not, then I will put this as a Google slide and you can drag and drop. Okay? Have a fantastic day, guys, and I will see you again soon.